One.
Good afternoon. I'm Pat Living with the Department of Health and Social Services, and I'll be your moderator for the COVID-19 update for today, Friday, April 24th. Following the statement of the Chief Medical Officer of Health, Dr. Brendan Hanley, we will go to the reporters online and in the room. As per our usual procedure, we'll take one question and one follow-up question from each reporter. We are hoping today to wrap up before 3 p.m. so Yukoners may participate in the virtual vigil for the 22 Nova Scotia victims. If we do have time, we may look for additional questions. Dr. Hanley?
Thank you. Good afternoon, bon après-midi. Shrokwachanni. As of today, we remain at the same number of cases. I'm pleased to say that the recent contact investigations are complete, with contacts identified and being supported appropriately. I promised to bring back testing details by the end of this week, so I'm going to walk you through the testing approach that we will have in place as of Monday. From here until Monday, we're sending details to our healthcare practitioners so that they can be prepared. We're preparing to have the self-assessment tool changed for Monday, as well as the 811 line. As always, your healthcare providers through community health centers, emergency departments, or the respiratory assessment clinic are ready to help if you need medical assessment. Here's what the new testing criteria will look like. We will still be keeping a strong focus on people who have traveled within the last 2 weeks, either outside Yukon or internationally. Just to remind you, all 11 cases to date are linked to travel outside Yukon. For this group of people, we are now casting a wider net by including not just fever, cough, or difficulty breathing, but symptoms like sore throat or hoarse voice, headache, runny nose or nasal congestion, vomiting or diarrhea, fatigue, muscle aches, loss of taste or smell, and that's the list. So why this larger group of symptoms? Well, this will enable us to potentially capture this group of people earlier for testing, as we know increasingly that although the respiratory symptoms continue to be the most consistent and important ones for identifying COVID, this illness can present with a wide variety of symptoms. Secondly, as test volumes decrease and we move out of flu season, we are simply seeing less people come in for testing. By lowering the threshold for people to come forward for testing, we can maintain a relatively high volume of testing. The next category of testing is for people who have an acute respiratory illness but do not have a travel history. This effort is a precautionary approach to detect any unrecognized cases or chains of transmission that may have been missed through the former approach. So these are the people that we have always been looking for, those with cough, fever, or difficulty breathing that could be COVID, even with no travel history, that would allow us to identify any signals for community transmission. Previously, we were looking for this signal through our influenza testing, as each influenza test was also tested for COVID. We have not to date found a single case of COVID through these tests. However, now that influenza is no longer circulating in Yukon to a significant degree, we wish to maintain this high degree of sensitivity for any unrecognized COVID illness in Yukon. Also, it's worth noting that our physicians have always had the ability to ask for testing even in people who don't meet our published criteria if for any reason they have a suspicion for COVID. I understand that when I talked about living the new reality the other day for the next 12 to 18 months, that there were many people who were surprised or even upset to hear this. I'd like to reemphasize that this is the time frame we have to consider until we get to a reasonable expectation of vaccine availability. But that does not mean that we have to stay right where we are now with restrictions. Again, if we continue to do what we're doing with the right conditions and in collaboration with the rest of Canadian jurisdictions, there's much that we can do to allow for some opening up. There's a long list of possibilities, and we're working on a plan right now, just as we are seeing what other jurisdictions are doing. This needs to be a carefully organized plan, and it must be that at the same time we continue to meet the conditions that will allow us to open up. These conditions are reducing imported COVID risk by maintaining a controlled border, keeping our health care and our public health capacity to continue to be able to respond to any level of need should COVID clusters or outbreaks occur. All workplaces in compliance with COVID prevention practices, and that we engage fully with communities and stakeholders in our activities. And don't forget, this is all the while we continue to promote and practice the 6 measures of safety: physical distancing, regular hand washing and sanitation, staying home when sick, limiting social gatherings, avoiding non-essential travel to communities, and self-isolating when required by orders. This is part of our new normal that we can fully expect to continue over the next year to year and a half. Since it was William Shakespeare's birthday yesterday, I thought I would honor his memory with a couple of his quotes that seemed rather apt for where we are today. We have seen better days. I'm sure we would all agree with that. But we can also say with confidence, and this is not what he said, but better days are ahead. And here's another one worth thinking about. Our doubts are traitors and make us lose the good we oft might win by fearing to attempt. We have important things to do, and in the face of uncertainty, there's always doubt. But we cannot stand down, we cannot hide. We must proceed, but with the right measure of humility, trust, confidence, goodwill, and resolve. That's all for today's update. Thank you. Merci. Buenas tardes.
Thank you, Dr. Hanley. We'll now go to the phone lines. We'll start with Jane from CBC.
Hi, Dr. Hanley. With the changes in the criteria for testing, I guess you mentioned that there's been fewer people coming in for testing, and this will keep the number of people coming in. It will lower the threshold, and so more people can be tested. Can you just explain that a little bit more?
Well, sure. I mean, we have seen a lot of testing to date, but we have seen, like in many places, we've seen a drop-off in testing rates. So one of the indicators of how well we're doing with testing capacity, and not the only indicator, but one of the indicators is numbers of tests per population. So we, like everyone else, have been seeing that number drop, and that drop has been largely due to a drop in viruses circulating, a drop in influenza. So it certainly gives us a comfort level to look for ways to increase testing per population, per proportion. It's there's a lot more I could say, but in the interest of time, I think the key message is try to get testing numbers up. We know that we will be unlikely to get back to the same proportion when we're in the middle of flu season, when simply there are many more people sick. But we want to keep that threshold nice and low to really maintain that signal for any cases that we might not otherwise pick up, or pick up cases as early as possible.
Do you have a follow-up, Jane?
Yeah, my other question is about the plan that you're working on opening up. We've seen the plan from Saskatchewan that they're planning on opening up a little bit in May. When might we see some details about this plan that you're working on?
So I can't give you an exact date. I will say within the next couple of weeks, I will be able to give more of a precise answer as to when by next week.
Okay. We'll move now to Claudiane, Radio-Canada.
Oui, j'aurais besoin, Dr. Hanley, que vous me répétiez en français pour les fins de la radio, donc les changements à venir pour des critères de tests, de dépistage. les raisons pour lesquelles vous modifiez ces critères-là?
Oui, the question is to explain in French the expanded testing criteria. Donc, on a des nouveaux critères pour faire des dépistages pour COVID. La première catégorie, c'est pour continuer avec l'importance de tester ceux qui ont voyagé. Donc, pour les voyageurs, dans les 14 jours avant de présenter, c'est pour au-delà les symptômes traditionnels, la toux, les symptômes respiratoires, c'est d'ajouter d'autres symptômes comme les symptômes gastro-intestinaux, les malaises, la fatigue, les pertes les pertes de sentir et d'autres symptômes. Donc, une liste de symptômes qui doit être, qui va être expliquée quand on va publier tous ces critères. La deuxième catégorie, c'est pour ceux qui ont des symptômes respiratoires, toux, difficulté de respirer et fièvre, mais qui n'ont pas voyagé. Donc, ceux qui sont maintenant seront encouragés de venir pour dépister aussi. Et la raison, c'est juste pour maximiser, comme on a vu beaucoup moins de personnes qui viennent pour le dépistage, parce que maintenant la saison de la grippe est passée, on voit moins et moins de personnes qui viennent pour le dépistage. C'est pour augmenter le nombre de personnes qui sont éligibles pour continuer de détecter tous les signaux de COVID dans le territoire.
Une autre question, Claudiane?
Non, c'est bon.
Merci. Tim, CKRW, The Rush.
Hi, good afternoon, Dr. Hanley. You talk about the expanded testing parameters now for, people with symptoms. Does this include now people who haven't traveled or who say they haven't traveled internationally at all or within Canada? If someone comes in, you probably knew I was going to ask this question since I've been harping on you about this for weeks. But does this include now someone who comes in and says, I haven't been anywhere? Will you test those people and they're showing symptoms?
So Tim, that's now the second category of people, and those. But we really want to keep the focus on those with respiratory symptoms. So so it's not any symptom for those who haven't traveled. So again, it's really to keep that focus on the risk is still by far the greatest in imported cases. So all of our cases have been linked to travel, and that will likely continue to be the case. But in case of any missed signals, anyone that was missed by those criteria, we have that second category now where we're really focusing on people with respiratory symptoms who now may not have a travel history. And they are now eligible for testing as well.
Another question? Sorry.
Oh, sorry. No, that's okay. And maybe just an update on just testing the system going to Vancouver. We're seeing the numbers. You said they had to be in the teens, showing it was a good system. Obviously, they're in the low teens or single digits. Everything is still going well with the testing system going to Vancouver.
Yeah. So now we have, at least the last I looked, we had 5 flights a week with Air North. So the travel itinerary is looking good, and the turnaround times continue to be very good. So yes, I'm still pleased with the testing capacity that we currently have.
Okay, we'll move on to Gord, Yukon News.
I don't have any questions.
Thank you. Julien, Aurore Boréale.
Oui, bonjour, Monsieur Hanley. Donc, ma question est, une personne s'étant rétablie du COVID, doit-elle désinfecter ses objets personnels après sa quarantaine? Comme par exemple, ses objets à la maison.
Donc, la question, c'est si une personne, si il est récupéré, s'il faut désinfecter les objets, le matériel dans la maison, c'est ça?
Exactement.
Donc oui, mais pas nécessairement. Donc pour toutes les surfaces, c'est vraiment où la personne était dans la maison. Donc toutes les surfaces qui étaient plus ou moins en contact avec la personne, comme dans la cuisine, les salles de bain, tous les surfaces, les tables, donc, c'est peut-être pas nécessaire de faire tout centimètre de la maison, mais pour faire une désinfection, donc c'est pas une fumigation, c'est juste pour être sûr pendant la maladie et après que toutes les surfaces touchées sont nettoyées. Donc, c'est selon l'assumption qu'il y a des heures ou peut-être même des jours que le virus peut survivre dans des surfaces comme ça. I'll just repeat in English. It's about cleaning a house after someone who has COVID. One is, which I also point out in French, specific advice around that will always be given to the individual, and that will come from the expertise of environmental health. But yes, it makes sense to clean and sanitize those common areas where a person has been within the household while they are sick. But this does not mean a fumigation or any special measures that, for instance, might be carried out in a hospital room. So it's really just kind of a common sense cleaning after the person is recovered. Donc, je veux dire aussi, c'est tous les cas seront assistés et appuyés par les infirmières et avec l'expertise les officiers de santé environnementale pour donner les conseils spécifiques pour cette personne dans ce logement.
Une autre question, Julienne?
Non, c'est bon, merci beaucoup.
Merci. Chris at CBC?
Hi, yeah. Sorry, can you hear me?
Yes, we can. Go ahead, please.
Hello?
Go ahead, please, Chris.
Yeah, okay. Sorry, just wondering if Dr. Hanley could, I guess, talk about, even if we're not ready to hear or to release specific plans for reopening yet, I guess, can you just give us an idea of the calculus that will go into making that decision? Like, is this going to be, will it be strictly public health considerations? Will there be other things that play into it, such as, I guess, economic considerations?
Yeah, and definitely more on that to come. But yeah, the lens, let me say that the lens will be a public health lens, but the considerations are going to be all of the considerations we're all concerned about. Economic, economic being one of those considerations, as well as the opportunity for businesses and enterprises to reignite. We know that there's a lot of anxiety, but all will be through a public health lens. One of the public health lenses being, what are the consequences of staying too strict for too long? Recognizing, as I said many times, about the mental health effects, the effects associated with loss of economic opportunity. So that's all part of the public health consideration. So it's not even for me economic versus public health. It's being economic economic opportunity being one of those ingredients of a public health lens. So we're following a framework very closely, working with Canada, with the Public Health Agency, and with other jurisdictions, in a framework for assessing priorities, being able to assess priorities within a general framework that adheres to those conditions that I put out. Conditions such as maintaining our healthcare capacity, maintaining public health capacity, ensuring the borders are still controlled, and those kind of 6 conditions. And at the same time, as I said, making sure that we don't let go of the physical distancing and all of those other measures that we need to keep in place.
No, that's okay. Thanks.
Okay. I am mindful of the time, so I am going to end today's session. I'd like to thank everyone for joining us today. The next update will be Tuesday, April 28th at 2 p.m. We're changing to a twice-a-week schedule, so the next update will be Tuesday, April 28th at 2 p.m. Thank you. Thank you, Dr. Hanley.